Bonjour le peuple, bonjour, comment nous y pas oublié. Et, le monde qui connaît moi, c'est Marie-Francina, moi, fait review pour nursing, moi, vend livre pour nursing, fait, moi-même qui a problème, qui sorti en Haïti, qui pas jeune aucun monnaie d'eau, qui faut connaître que, sauter nurse en Haïti, ou obligé à l'école encore ici, dit au Marie-Sina, dit c'est pas vrai, c'est menti. Sauter nurse en Haïti, ou capable de venir joindre moi, ou capable passer dans the key to NCLEX success, côté que ou capable passer board of nursing sans problème. Ou venir ou puis garder sur website là et puis tout processus a fait sur website. Ou même tout qui c'est un CNA qui a problème pour passer. CNA ou ta même comme un CNA ou HHA ou a problème pour passer. Ou a problème pour comprendre comment pour étudier ou capable relais Marie-France Senat dans 631 708 21 21 ou bien qu'à passer dans le key2nclex.com. Leur besoin passer ou besoin étudier pour passer. C'est technique comment étudier qui succès. C'est pas juste prendre un livre lire. Les wap li, faut comprendre ça li. Le wap étudier, faut comprendre ça étudier. Pas oublier me dit nous pas gen body, le body system nan li pas changé. Li remain the same. C'est jonte vinn sur la terre, nous tout net gen même fonction dans body system. Nous gen même système yo. Nous gen the heart, nous gen the brain, nous gen the skin, nous gen the blood, nous gen the whole system, nous c'est même nan. Ça veut dire que maladie que yon moun gen nan yon système, c'est même maladie ça tellement ti. Oh shit. C'est même maladie ça que tout l'autre monde a bien dans même système là. OK? So, si que c'est même maladie ça l'a bien dans système là, maladie va changer si comprendre nous comprendre. En pile nan nous nous pensons que n'a joué sur Facebook là. On peut comprendre ça, but tout le monde qui sur Facebook, tout le monde qui sur TikTok, cap tapoter ou bien cap vendre yon bagay, c'est avenir pas eux à préparer. C'est avenir pas eux à ranger. C'est bill la kayo à payer. Ou même qui en bas live yo, cap tapoter ou bien cap voyer cadeau qui pas gain yon backup ou son monde qui perd du temps. C'est ça qui fait très important pour nous connaître comment pour nous étudier. Tant pis demander nous pour nous share de key to NCLEX. On m'en écrit pour moi côté Berlin de key to NCLEX share li so people could share li pour moi. OK, share li. So the key to NCLEX c'est website là, nous capable tout relire dans 631 708 21 21 ou même qui est problème avec NCLEX pas capable passer. Ou même famille a pu milliard djou gen longtemps fini ou pas jamais régler rien ou capable relire moi dans 631 708 21 21 pour acheter livre là capable passer dans Amazon on y mettez le key to NCLEX ou passer dans website là which is the key to NCLEX dans website là côté que website là ou capable au côté que ou capable acheter livre là directement avec Amazon ou capable acheter livre là directement avec Alabrace, avec Ingram, avec Barnes & Nobles, qui c'est le key to NCLEX. So, ou même qui vini au sorti en Haïti, ou préférez pas penser de, ou vini dans Biden, ou bien vini, n'importe jour vini, hein. Ou penser de déportation, instead pour penser pour construire tête, ou. So, ou capable d'apprendre au mail fait blanc, ou capable d'apprendre CNA, ou capable d'aller dans l'école to become an European. Ou capable faire tout bagay ça, ce sont des préparations pour avenir que yoye. Tout genre de bagay ça. Préparation pour avenir que yoye, c'est yo même avec li, ou capable arriver, mettez manger sous table, ou ka arriver faire chelber, ou ka arriver, mettez la caillou, en sécurité. So, pas oublier, dans de key to NCLEX, le key to NCLEX, c'est là où on est capable acheter livre là. Et c'est là tout capable contacter moi pour nous capable faire review. Moi j'ai review qui fait 3 jours par semaine, soit aller sur website là après. Comme ça tout moi gen review en privé et moi gen classe personne, moi gen classe en Zoom et moi gen classe en privé pour moun qui veut prendre classe et pour personnel yo. OK? So, là que ou acheter livre là, nous pas dit nous gen clé pour nous loger licence ba ou but nous même nous dit pas bon ici nous fort, pas bon ici nous kon ça board of nursing a chercher, pas bon ici nous kon qui gens pour nous entamer board of nursing, pas bon ici nous kon qui gens pour nous frapper board of nursing, pas bon ici nous connaît nous pas ka faire coup manquer. Nous pas ka faire coup manquer, nous pas ka faire coup rater, pas bon ici. So, nous capable joindre de qui tout un klexo dans TikTok, nous capable follow dans TikTok parce que ap gen un review. Dans jour k'ap vini yo la ap gen un review que m'a bay un prélude dans TikTok, un review que qu'on a parlé de en série de topic dans nursing n'a fait li non semaine nan et son petit review que en pilote moun moi fait li, moi li réellement intéressant, un petit review très simple, moun capable vini. Et si qui ça ti prélude ça ou Afrique. On moun qui besoin mon carré dans 631 708 21 21. On moun qui besoin, mon moun qui t'a aimé participer dans review ou capable relire dans 631 708 21 21 ou même qui on nurse qui sorti en Haïti qui ou pas jeune mon edo pour convertir pour transférer ou bien pour convertir ou bien pour participer dans l'examen clé sans pas boire ici totalement mon edo avec process là. Ou capable contacter de kitounclex.com ou au carré dans 631 708 21 21. OK? So, vas-y. Et n'a capable gen pas oublier pour nous al follow dans TikTok qui c'est mettez TikTok de Berlin can mettez TikTok account là moi. Nous ka follow dans TikTok, nous capable follow moi dans TikTok côté que nous capable aller pour nous tout update yo, pour nous qui le cap gen classe, qui joue cap gen classe online yo, qui le cap gen live on Facebook pour inclexan live ça aussi live pay yo. So, nous carrément tout dans 631 708 21 21. C'est pas seulement chita en bas live, mon ap tapoter, voyer cadeau. Faut pas sa tête pour tout. Faut pas sa tête pour, faut mettre dans tête où est-ce que, m'a préparé lui-même. Et bah, me dit non, ouais, nursing, non. N'importe branche ou prendre nursing, non. Quitte c'est Homelfield, quitte c'est CNA, LPN, RN, family practice, you know, n'importe branche moyen dans nursing comme là. Parce que les grands désastres, c'est nous, les grands désastres, tout Dieu viré sur nous. Parce que tout Dieu a cherché nurse, a cherché CNA, a cherché docteur, tout Dieu net, ou même qui est un docteur, qui était en Haïti, qui est un docteur, qui vient pas boire ici dans moment là, qui a problème, qui vient pas boire ici, qui pas capable de manœuvrer pour lui al travail, as an dit, work après examen, moi conseille nous très important que nous relais moi dans 631 708 21 21 que process qui a fait nous a commencé travailler en RN pour nous capable faire comme là pour nous capable concentrer dans étudier parce que l'on a étudier ou gain bill c'est gros cause. OK? Pas oublier dans le moment que m'a parlé avec nous là, pas oublier que m'a dit nous ça encore et OK. So nous connaissons yon ti jan bonheur, tout le monde qui t'a remen rele mwen pour question de nursing, question de acheter livre lan dans Amazon, livre lan nous ka jwenni dans Amazon, The Key to Inclex, li dans Amazon, li nan Ingram, li nan Barnes and Nobles, livre lan tout côté, li nan Book Millions, Book Millions, c'est tout côté. So nous ka acheter livre lan tout côté. Si nous pouvons ka prendre review review moi pour opinion dans moment nous bon discount c'est $1000 pour AM c'est 1300 et ou même qui sorti en Haïti qui t'a remen fait comment t'a dit ça et process pour capable chita pour prendre une collection nous gon package pour qui 1500. Okay. So, j'ai pas oublié pour the key to NCLEX, Key to NCLEX, the key to NCLEX, it's for you to study for your RN or your LPN exam. The NCLEX is the key. Without you passing your NCLEX, there's no way you could get your license, you know? So for you to get your license, you need to join a very, very, very successful very successful reviews, which is the Key to NCLEX. The Key to NCLEX is very successful, and I guarantee you passing. I guarantee you passing if you apply everything that I said. If you follow my review very closely, there's no way for you not to pass your NCLEX, because I know what exactly they're looking for. I know exactly what to do, and I know exactly how to show you the best way to study, and to study less amount of time on the day and the daytime, to study while you're working, to study, and you don't have to be overwhelmed. I have my book is in Barnes and Nobles. You could always buy my book, which is The Key to NCLEX and Barnes and Nobles. And also, you could also go to my website, www.thekeytonclex.com. And you'll find the books there. You'll find all the details. You'll find when the next review, the dates and everything. And also, I'm planning on having a review on TikTok, and it's going to be by next week. The key to nclex.com will show you exactly what you need to know for you to pass the NCLEX. Remember, the patient want to see you as their God. The patient is they want you to treat them as your family. They want you to do things that you would want people to do for you if you were in the same situations as them. So as long as you understand that concept, you should be able to make it. So if you go to the hospital, and let's say you lay on a bed. Let's say you're in the hospital bed. And then guess what? While you're in the hospital bed, you certainly having shortness of breath. What would you like someone to do for you? Your first reactions will be, oh God, I'm dying, because there's no gas exchange. You know, if there's no gas exchange, what would you like someone to do for you? If you were in the same situation as the patient, don't you want somebody to raise your head up? Don't you want to raise the head of the bed? Don't you want somebody to hold your hand and, reassuring you that it's not over? We here to help you. Don't you want somebody to be able to press the button and call for help for you? Don't you want somebody to stay in the room with you until the doctors or providers get there, and then we could start doing whatever it takes to rescue you? Genre de bagay sa yo se depan nan ki kotorye nan l'hôpital lan. So, lo gade nan examen, lo yo dou nan examen, lo yo dou Mr. John is 48 years old. Mr. John was recently discharged from the hospital with pneumonia. And Mr. John is now returned to the hospital for cellulitis of the right legs. So that means, premier bagay ou suppose gade, ou suppose mande tête ou, why yo do que Mr. Bakon sa vle di, bakon nou ba vle man. Okay. Okay. So now, ou se m'a demandé why the Board of Nursing écrit une question que Mr. John is 48 years old. Why Board of Nursing pas dit moi que Mr. John was recently discharged from the hospital with pneumonia? Why giving me the age? So now it's a big question mark. Why telling me he was discharged with pneumonia and returned now with cellulitis of the left leg? Whenever the Board of Nursing, whenever you went to the NCLEX exam and you see they put the patient age, the location of the patients, and whenever they mention the patient was recently discharged, they are sending you a message. The message they're sending you is clear. They're sending you that message is because they said Mr. John is 48 years old. He was recently discharged with pneumonia. Now you return to the hospital with cellulitis. That means there's something you need to do. It's teaching. The reason Mr. John may be unable to take care of himself. Why discharge? Less than 48 hours you back with cellulitis of the legs. Maybe Mr. John have poor visions. Maybe Mr. John don't have the family centering. Maybe Mr. John don't have the support in the community to help himself. You need, as a nurse, you need to get to the bottom of the problem of Mr. John. Let's say, let me give you another example. When they tell you Miss Lydia, 76 years old, was recently discharged from the hospital with hypertension, high blood pressure. And then, less than 48 hours, Miss Lydia returned to the hospital and a crisis. An hypertension crisis. Wow, now you have a problem in your hand. You got to look at the age. Miss Lydia is 76 years old. Miss Lydia maybe have poor vision. Miss Lydia maybe don't have the help needed to, to help him taking her medication. Maybe she went home. Maybe she went home. She don't have the money to buy the pills. Maybe she don't have the resources. So we want to know why Miss Lydia is non-compliant with her medications. Because if Miss Lydia was recently in the hospital for high blood pressure, was discharged and put in beta blockers, and then she came back to the hospital, between 2 to 3 days, again, less than 48 hours, less than a week to the hospital, we have a problem. It's either, Miss Lydia, we need to investigate a little bit more. Who we gonna get? The Board of Nursing is asking you, who you gonna get involved? At this point, I need the social worker to get involved. Because the social worker will help Miss Lydia with her finance, and the social worker will help Miss Lydia to find medication for free or cheaper price. Or maybe we need to have the doctor, give scripts for generic. Instead of trademark, we need generics of medication because they're cheaper. So, le que patient, le que nous, question en réponse dans la donne. C'est raison ça qui fait un pile moun pas ka passer bot là. Question en réponse dans la donne. Depuis au mention, bon nous prenons l'autre exemple. Le on comme ça que, Mr. Carlos, Mr. Carlos came in today with sickle cell anemia crisis. On arrival, Mr. Carlos received 1 liter of normal saline, 1 liter of normal saline, and they ask you now, what is your next step? As a nurse, what do you think the doctor going to order next? Because remember, Mr. I want to know what is your next step as a nurse. What do you think the doctor will order next? You need to think about the disease process. You need to know that sickle cell anemia is a circulation problem. The reason, because you have your hemoglobin, it's abnormal. They are abnormal. It's either they have an S shape or the edge of the hemoglobin is rough. So, pour hemoglobin not travel to your circulatory, it must be smooth. S'il pas smooth, li pa ka travel, can't travel. So, because hemoglobin not pa ka travel, your next thing, a lot of people think, when somebody come in with sickle cell anemia, your first thing to do is oxygen. Guess what? You could give oxygen. That's the first thing, because, we need more oxygen now. And some people think it's pain medication after the oxygen. It's not. You could give as much pain medication as you want. It's not going to work, because we have a problem. We have the cells that clump. We have the hemoglobin that clumps. So we need to push them. We need to move them. If we're not able to move them, that's the reason the patient is in so much pain. So we need to start IV fluids. If we cannot, let's say the patient is a hard stick patient. The patient is a hard stick, we need sono guidance, and then God forbid, you're the nurse and the ED, you don't know what to do with sono guidance. So guess what? You need to rush your goddamn self to the doctor and say, Doc, we're having a problem. The patient is in a crisis right now. So what do we do? I tried to put an IV, it doesn't work. So the doctor will decide if he want to do PO fluids until they get to the patient and inserting an IV. So now, for you to correct the problem of the patient, you need to know the pathophysiology of the disease. If you don't know the pathophysiology of the disease, it's not going to work. If you don't know the pathophysiology of the disease, it's not going to work. So you must know that sickle cell anemia, the cells are in trouble because they have the rough edges. And if it's the S shape, that's even worse. Because for your hemoglobin to provide, for your hemoglobin to travel, because remember, your hemoglobin brings oxygen to your cells. For the hemoglobin to bring the oxygen to your cells, they must be smooth. They must be round. Like the moon, they must have a smooth edges. If the edges are rough, it's not going to work. If the hemoglobin, the shape are not, round, smooth, if it's an S shape, you're in trouble. When you want to know this is the key. If you study, you know your stuff, and you prepare to take your exam. If you study well, and then you go to take your NCLEX and you realize you don't know the first question. If I was you, I'll choose A and move on. Because if I know I did everything, I study hard, and I'm not going to let the first question deter me. I am going to, and my answer going to be A. If you know your stuff, if you look at the question very closely again, you look at the question very closely, and you said, you know what? I know the disease they're talking about. I don't know the answer. Process of eliminations. In the middle of the process of elimination, if you eliminate 2 answers and you have 2 answers left that trouble you, Believe me, the answer is A. Believe me, the answer is A. That's for people who study. I'm not talking about people who goes to the NCLEX blindly. I'm talking about people that study. I'm talking about people that know they they invest time in their study. And then they went to take their exam, and God forbid the first question they don't know the answer. Believe me, the answer, if you do your process of elimination correctly, your answer should be A. Because Board of Nursing have a bunch of questions on the NCLEX exam that the answers are A. A lot of people don't know that. But the only people who will experience that kind, experience, it's people that study. So, we're going to have reviews. If you go to the key to nclass.com, we're going to have some reviews in Creoles, and then the schedule going to be online. So go to the key to the nclass.com, and you're going to find your schedule. You're going to find, because, it's not every day I'm going to come up here and then mix English and Creole. So I decided to have some days reviews going to be in Creole, and some days the review going to be in English. So, next thing, moi vle nou kompren. Le ou, c'est ça nous fait dans the key to NCLEX. The key to NCLEX.com, c'est ça me fait. Moi, explico NCLEX, sans que n'importe jon rive devant NCLEX, sans pas capable, pas joindre réponse. Le que, n'a pas un exemple. Nous allons prendre un petit exemple bien déterminé, très court. So now, nous allons prendre le que besoin pour une question, pour m'expliquer nos bagages dans la question, hein, pour nous comprendre plus bien. So now, laissez-nous un patient, nous passer venir l'hôpital là avec severe headaches. Severe headaches, patient abdou, tête la fait mal, li gen rigidity, ça veut dire cool, li pas réellement viré cool. So doctor a dit, you know what, bon mal checker pour moi if it's not meningitis. The doctor decided to do a lumbar puncture. Board of Nursing pa pral djou, le ou fin fait lumbar puncture pour combien de temps pour patient rete dans certaine position. La mando pour qui ça patient ça, you fin fait lumbar puncture, doctor a dit, you know what, nous fin fait lumbar puncture, it's very important nous pas move pendant n'a fait là parce que ka tout paralysé. So ça veut dire supposé coucher flat. Board of Nursing pral do après lumbar puncture là, fin fait pour combien de temps ou patient ça pral coucher flat et pour qui raison? Nous connaissons raison que fait patient coucher flat là, c'est parce que ou besoin lumbar muscles relax. Parce que pas oublier nous sommes traumatise lumbar là, nous sommes entré en gros nido, mais non gain nido hein, dans lumbar moun nan, nous connaissons lumbar la gon équipe ciseau qui pas jouer. N'importe si déplacement le fait qu'à cause paralysation. You don't want that. C'est ça que fait ou après, demando pour coucher at least 4 to 6 hours flat. Okay, so hospital, Board of Nursing yon revised part in a question gunya, li mande for 4 to 6 hours, which is a long time to me. And also, wap non seulement relax lumbar, wap relax, wap yemande pour ki so fait mon nan coucher flat, c'est raison ou besoin ni lumbar lan, ni abdominal muscles lan, relax. Ki sa moun sa ka genye as a long term? Moun ki fait lumbar puncture as long term problem yo kon genye, c'est headaches. Okay? Most of the time they're suffering from headaches. So, c'est ça fait toujours di nou, l'autre de Board of Nursing, gen yon question, la mando, la mette l'âge moun nan, ki kote moun nan ye, you must take your time pour comprendre question. Le Board of Nursing do kon sa, Mr. Jean te vini, Board of Nursing do, Mr. Jean vin l'hôpital. Mr. Jean gen 78 ans, premier bagay ou supposé faire, it's souligner 78 ans. Parce que, raison yo bon l'âge là, c'est parce que yo vle mener yon côté. If they told me, parce que j'aime pas traiter Mr. Jean, qui 78 years old, qui vini avec abdominal pain, c'est pas même Jean m'a traité yon ti moun 11 ans, yon ti moun 25 ans, et qui gen abdominal pain, raison. Parce que as you age, your system decline. As you age, your body responds to certain things differently. So now, Board of Nursing is telling me, Mr. Jean, come into the hospital. He's 78 years old. Mr. Jean is admitted to the ED. Hello? Why they tell me Mr. Jean is admitted to the ED? C'est là nous fait ouais parce que si on dit Mr. Jean is admitted to the ED, that means Mr. Jean is already been seen in the ED. Mr. Jean is waiting for a bed right now. En pile nan nous pas well comme ça. Depuis nous pas well comme ça n'a pas mauvais answer. Mr. Jean, let's listen to this. Mr. Jean came to the hospital. Mr. Jean is 78 years old. Came into the hospital with sickle cell crisis, admitted in the ED. Guess what? Sickle cell crisis. Now, what am I gonna address? The word admitted. Admitted nan li chanje ball game nan pou mwen. Li chanje game nan. Because yo di Mr. Jean came into the ED. Mr. Jean is 78 years old. Came into the ED with sickle cell crisis. Is admitted to the ED with sickle cell crisis. The game changed. I mean, now if they said, what is my intervention? What is the intervention now for Mr. Jean? Am I gonna start fluids? Premièrement, I'm supposed to garder l'agent 78 years old. Deuxièmement, I'm supposed to garder pour qui salvini, which is the disease, which is sickle cell crisis. Troisièmement, I'm supposed to garder words yo di nan admitted to the ED. They didn't tell me Mr. Jean came into the ED. Admitted to the ED. Little words change the meaning of your interventions. So, puisque Mr. Jean, regardez bien, c'est ça fait me dire non, c'est nous pas comment nous faire question, nous pas comment nous étudier. Mr. Jean is admitted to the ED. Regardez bien, Mr. Jean came into the ED with sickle cell crisis. He's 78 years old, came into the ED with sickle cell crisis. Mr. Jean is admitted to the ED now. Si you tell me Mr. Jean came into the ED is different. But Mr. Jean, 78 years old, admitted to the ED with sickle cell crisis. The word admitted, the agent admitted changed my answers now. What is my first intervention? Okay, m'bezo konnen est-ce que intervention nou? Now? Okay? Est-ce que intervention nou now? Is it oxygen? Is it hydrations? Is it pain medication? What is your intervention now? Because Mr. Jean, 78 years old, admitted to the ED with sickle cell crisis. ED, location is important. So what is your intervention now? What you gonna do now? Are you going to give oxygen? Are you going to increase fluids? What you gonna do now? What you gonna do now? You know, okay? What you gonna do now? That's what I wanna know. Are you going to give oxygen? Do you think it's time for you to give oxygen? No, absolutely not. You know why? Because Mr. Jean passed that stage already. He's admitted to the ED. That means he's already have oxygen. He's already have blood work done. He's already have fluids going. Now your job is to manage his pain. Now that's when the pain medication is continuous. So you gotta monitor his pain, do his pain assessment. You know, make sure you do pain teaching. Make sure you tell Mr. Jean, let me know. Don't wait until your pain escalate. You know, let me know as soon as your pain come back. Do not wait until your pain reach a level that is very hard to treat. So let me know when you're in pain. Ring the bell. Let me know when the pain come back. Let me know if you're comfortable. Because remember, Mr. Jean, 78 years old, is admitted. The word admitted changed my courses of my answers. If they told me Mr. Jean, 78 years old, came into the ED, that means Mr. Jean just got to the ED. So now if Mr. Jean just show up on my ED, my job as and then let me tell you, came into my ED. They didn't tell me Mr. Jean is in triage yet. You understand? My job now is to advocate for Mr. Jean. So for Mr. Jean to be triaged, Mr. Jean to have that. My first job is to do one thing. Remember, your hemoglobin is responsible to is the food. Your hemoglobin carry oxygen to your cells, and oxygen is your cell nutrients. The same way we manger du yak banan, the cells live in oxygen. That's their food. If the hemoglobin is damaged, you cannot carry the oxygen to your cells. What do you think gonna happen to you? You're gonna be in pain. You're gonna be weak. And you're gonna be having shortness of breath because you don't have enough oxygen going to your cells. Your cells are in distress. So guess what? Your job as an RN, remember, you allowed by, the policies, by protocol, according to the Board of Nursing, according to those big people, you're allowed to give 2 liters of oxygen without a doctor's order. So guess what? If you are mashy, let's say, you're going outside, it's hot, you usually walk 2 miles, and then suddenly you're sweating, you don't have no water, and guess what? You're starting having shortness of breath. What do you think what is your first reaction? Don't you want to sit somewhere? Rest. When your oxygen is low, it's rest. You're gonna rest. Rest mean I'm not gonna walk. Rest mean I'm gonna lean against a pole. That's fucking rest. Rest mean I'm gonna sit on a chair. I'm gonna sit on the floor. I'm gonna rest myself somewhere. I'm gonna lean on my friend. That's rest. The Board of Nursing upon la. A lot of people think rest is putting the patient on a bed. They're looking for a bed. No. If you find a bed, you drop the patient on the bed. But if you don't find a bed, rest is anywhere you could lean. You could lean on a tree. You could lean against a wall. You could be walking on a mall and then you start having shortness of breath. You lean against the wall. That's rest. Your friend ou appuyer sous un mona, that's rest. Remember oxygen, hemoglobin, jobly, c'est transporter oxygène to the cells, cell yo même y a tant hémoglobine pour qu'on manger en bas yo qui c'est oxygène. When you give the oxygen, when hemoglobin bring the oxygen to the cells eat, they have like, they have strength now. Now they're not weak. Now you have oxygen needed for you to do all of your activities without having shortness of breath. So you need to, when they tell you, if they tell you, you have 2-3 patients, you the morning nurse, you come in, you take reports, and then you the morning triage nurse, you came in at 7, you take reports. The board of nursing put you in triage. You gotta know where they put you. You gotta see in the questions. The board of nursing is talking to you. And the question is talking to you. He put you in the situation. You need to find yourself where they put you. If the board of nursing said you the triage nurse, that means they put you in triage. So you're gonna have to think as a triage nurse. If the board of nursing said you are the nurse in triage and you see 3 people waiting to be triaged, you're kind of busy because the triage nurse will give you a report had a rough night. So now he said, between those 3 people, you tell me, I'm going to give you a scenario. You tell me who you're going to take first. He said, we have a young kid. He's like, 17 years old. Again, mark the age. 17 years old. Playing basketball and suddenly complaining of chest pain. You got a 70 years old, came into the hospital with altered mental status. Last known well was at 6 a.m. Now it's 7. 70 years old, altered mental status. Last known well was 6 a.m. So, and then you have one who came in, who's in talks, came in to you and said, when am I going to see the doctor? I am not too well. Who you going to see first? The board of nursing put you in triage for a reason. The board of nursing is addressing all of these for a reason. The board of nursing is giving you the age for a reason. The board of nursing is giving you the last known well for a reason. And they're also giving you the time for a reason. Okay? They're also giving you the time for a reason. Because the board of nursing is talking about the last known well on the patient, that become my priority. Reason? A 17 years old who have chest pain after playing football, I'm not too concerned, but it's not my priority now. The reason the board of nursing is talking about a 70 years old male who his last known well was 6 a.m. and he has altered mental status now. So 2 things guide me to focus on this man. I'm going to ask myself why the board of nursing focus on the last known well, which is 6 a.m. If somebody was well at 6 a.m. and suddenly between 6 a.m. and 7, we don't know what happened. The patient have altered mental status. I may have a patient with a stroke in my hand. I don't know. That's urgency. So because of that, I'm taking that patient in first. Because of that, I'm going to call a rapid response. If the reason I'm calling a rapid response is because I'm in triage. The reason I do that is because if I was inside in the emergency room, I will call a stroke code, a stroke evaluation code. because I'm inside, I'm doing EMS triage. But if I'm in triage, the home attendant bring that 70-year-old to me in triage, I have no choice. I need everyone to come to me out there because I have other patients that need assistance. I'm gonna call for a rapid response. When I do that, I'm expecting the CNA or the nurse, the doctor, whoever is coming, I'm expecting them to come with a stretcher. I'm expecting them to roll outside with the blood pressure, with the finger stick machine. I'm expecting them to come, evaluate the patient and bring the patient inside so the patient could have immediate attentions. So the Board of Nursing give you age. They give you last known well for a reason. Last known well, it's for stroke. Last known well is for cardiac most of the time because we want to know how to address this patient problem. We want to know how to fix this patient. We don't want to waste time. We want to give the patient every opportunity to return back to their well-known state. That's what we want. So, that's what we want. That's what we want. Hold on. We want patients to return to their well-known state. Because the Board of Nursing in the question, they're giving you hints. They put you places so you could answer the questions. Oh, got travail mon boss mi là live moi. You know, they're giving you a reason for you to think. When Board of Nursing, remember this, when Board of Nursing said you want triage, a pregnant woman, when they give you the weeks, is 20 weeks pregnant. 20 weeks. Remember, according to NCLEX, 18 to 20 weeks, pregnant need to go to OB. But guess what? The Board of Nursing is telling you, 35 years old, 20 weeks pregnant. You gotta ask yourself why. Why the Board of Nursing is telling you she's 35. That's one thing that supposed to catch your mind. And they tell you she's 20 weeks pregnant, and on her phone, the triage phone, page the damn doctor. Doctor, we need a doctor in triage for 20 weeks pregnant evaluation. We need a doctor in triage for 20 weeks pregnant evaluation. You already put as you calling the doctor, you must have the patient in a wheelchair ready to go to OB. When the doctor comes in, he look at the patient, he asks a few questions, he make the decision to take the patient to OB. If he's gonna take the patient to OB, a nurse need to go with the patient. You need to have the emergency box with you. And you need to make sure you're able to grab a phone if the situation become more intense for you. As you transferring the patient to OB, you make sure that you grab the damn phone in the elevator, you call for help. And believe me, by the time the elevator's door open, everybody's going to be there waiting for you. 20 weeks, 18 to 20 weeks, do not come to the ED if they don't have a medical emergency. If they don't have any medical to be treated. for us. Like if they have high blood pressure or they have gastritis, they have something, if anything relating to pregnancy, is they gotta go to OB. That's where they treat them. That's the reason when you see the question, on the question, your answers are there. The answers are in the question. But look, okay? Look, ou gen yon patient. Lò yo do, lò rive nan matin. Let's say, you get to work, it's like 7 in the morning. If your charge nurse said, you know what? You're in recess today. If you're in the emergency room, you were trained to be a trauma nurse, they put your ass in recess. Let me tell you, you better have your room prepared to go. The board of nursing have a question like this. They ask you, combien, what is your first thing when you realize you're in recess? Your first thing to do is to make sure that your room is prepared, set to go. Make sure you have your IV setting. Make sure you have your embu bag. Make sure you have your cardiac monitor ready to go. Make sure you have 3 sizes of cuff, blood pressure cuff. Make sure you have, if you have one for pediatrics cuff. You have a medium, a small, a medium, and a large and extra large. You have to have 5 cuff ready to go. Your, incentive, your O2 saturation, your sensor should be there. Everything should be there. Your IV fluid should be there. Your line should be there. Everything. You have normal saline. In the ED we use normal saline lactate ringer a lot. Make sure you look at your card. Everything is ready to go. And make sure you look at your code card. That's very important. Your code card. Make sure your code card is locked. If it's not locked, they used it last night, they didn't replace it. Make sure you call pharmacy and let pharmacy know that you need a new code card ASAP. Because you don't know when you're going to have to jump in the recess room, when you're going to have a cardiac arrest, or when you're going to have somebody that you need to intubate. So you need to have your room prepared. And you need to make sure that there's gown available for the trauma team. Because when the trauma team come down to you, they come down from the floors. When you page trauma team to the ED, trauma team to recess 1, trauma team, they come in from 10th floor, 8th floor, 9th floor. They come in all over. The team know who they are. You're dealing with 6, 7 doctors that's standing, and they don't know where you keep your stuff. You must have you must have everything ready for them. And you must make sure that your sono machine is charged. Because if you have a patient who was in a car accident, they want to look at the patient's thoracic. They want to use the sono machine. He has to be charged. You want to make sure that your rapid transfuser is charged. You want to make sure all of your machine, your EKG machine, you want to know who's the EKG tech that are assigned to your room. You want to make sure the answer in the Board of Nursing question is prepare my recess room. That's the answer. As a recess nurse, you come to the ED, you find out your charge nurse said to you, you're going to be recess nurse today. What would be your next task? That's exactly what the question said. What will be your next task? Your next task is to make sure the recess room is ready to go. It's prepared and ready to go. And there's another question. They may ask you, what is missing there? They give you the code card is closed. They tell you your the suction, your ember bag, everything. What is missing? What is missing? The emergency box. Because as you go into CT scan with that patient, let's say the board of nursing tell you have to take your patient from research to CT scan. CT scan is on the second floor, is not on the first floor where you at. What do you carry with you? You gotta carry the emergency box. And who go with you? The doctor and the respiratory therapist. The doctor must go with you. The respiratory therapist must go with you if the patient is intubated. If the patient is not intubated, the respiratory therapy don't need to go with you. But the doctor must go with you, and you must carry the emergency box with you. Because God forbid, the patient crash. How are you going to rescue the patient? And then, let's say on the second floor, usually most of the hospital, their ICU are on the second floor. Usually they have casket in 2 places in a hospital. They have casket in the emergency room. The designated casket usually is on the first floor. And then they have casket again in ICU because it's 2 critical places. So when you have casket in ICU, you transfer the patient to casket, and guess what happened? Guess what happened? If you transfer the patient to casket on the second floor, the patient code, who's responsible for the patient? The ICU nurses. Oh yes, they have to take over. The doctor is going to stand there, but ICU nurses take over. Why? The reason is the ICU nurses is because you going to push medication, emergency medication, and they are narcotics. And then the ICU nurse must show she took that medication and she gave it. At this point, you're a bystander. You stand there, you let them do the job. That's the reason when ICU nurses heard the ER nurse, CT scan is not working downstairs, or we have a major disaster. We have so many patients, we need to scan them. So because we have somebody on the table, we take the other patient upstairs. ICU nurse is in the alert, they're upset, they hate you. Because they said, if God forbid that patient, crash up there, they're in trouble, they're gonna have to leave their patient and take over. Hello? I'm telling you guys. So, the board of nursing exam is not that hard. His heart is where you see yourself. Is how you see yourself. When they tell you, let's say, you see a question, not delegation. Delegation is simple as good morning. Let me tell you how it's simple. Okay? It's simple as good morning. Delegation is simple as good morning. Let me tell you why. Let's say you the charge nurse. You work 7 a.m. to 7 p.m. As you walked in, the charge nurse who worked last night told you, hey, total disaster today. You asking the charge nurse, what's up? We have 3 call out. 3 call out. We have 2 nurses who call out, 2 RN call out, and we have 1 LPN that call out. CNAs, we have 1 CNAs that call out. So now, she told you, I did everything trying to replace them, but I didn't find nobody. So guess what? Your job is to call the nursing office. I'm calling the nursing office and, complaining, go whining, say, oh my God, I'm in trouble. I need 3 nurses. I'm short of 3 nurses. I'm short a PCA. The nursing office said, you know what? I'm going to pull a nurse from OB because, when I'm looking at labor and delivery, they don't have nothing going on. So I'm pulling 1 nurse from OB for you. And I'm going to go to psych. Psych is kind of empty, dead. I'm going to pull a nurse from psych. And he said, I look on the night floor in med-surg. I see an LPN, she's sitting there running her mouth. I'm going to pull her downstairs. The only thing I don't have for you, I don't have a CNA. So now the OB nurse show up. The OB nurse is no help to the ED. So now what you do, the board of nursing want to know what assignment you're going to give to OB nurse. Remember those OB nurse, what they do up there, They just know how to monitor high blood pressure. They don't deal with intubation. They don't deal with, with high, how do you call that? High alert drugs. They don't deal with those things. They just deal with metoprolol, magnesium sulfates. That's what they deal with freaking heparin. That's all. When they don't do no drips, those people from OB, they don't do those things. So now this nurse from OB come to you shaking like a fucking sleep, like a fucking leaves, and telling you, oh, they float me down here. And where do I go? So now I have to have a meeting with my staff. I want to know, the nurse that take report this morning, what type of patient you have. If that nurse told me she have a patient with high blood pressure, I said give it to her because she knows how to take care of high blood pressure. If she told me she have a patient who is on heparin drip, I said give it to her because they give heparin. They heparinize the fucking patient up there sometimes. And then if she told me she have a patient who's from a nursing home, long-term care, who's here for abdominal pain, I'm going to say give it to her because they don't deal with certain things. I want to make sure they stay in their scope of practice. This is what the Board of Nursing is looking for from you. The Board of Nursing is looking to see if you're able to keep people in their scope of practice. So now the nurse who came from psych, I'm going to make sure with my nurses, and I said, do you have a one-to-one? If they have a patient in one-to-one, the patient is not intubated, it's not a patient who's done a one-to-one because we put the patient on one-to-one because the patient is pulling out his tube and everything. This nurse going to, take care of that patient in one-to-one who's waiting to be seen by psych who's suicidal. See, because that's her job. That's what she do. We're going to keep her in her scope. So now I'm going to go around and ask another nurse. I said, what do you have for this nurse? She works psych. She can't do much. She's going to give me somebody who's supposed to get, asthma treatment like albuterol. So now I know all she need to do is plug this freaking, aerosol and the oxygen and give the treatments. So you got to keep nurses in their scope. If you don't keep them in their scope, Board of Nursing will rate you as a very dangerous nurse. Okay? You're very dangerous. Okay? So now, the LPN now, remember I didn't have a CNA. Remember, LPN is not that far from a CNA. Nobody is far from a CNA, but LPN is closer to them. So that means I'm going to use that LPN as a CNA for the day, because I lost one CNA and she's the only person with the least scope of practice that I needed to move on. So I'm going to use her as the CNA for the day. So now problem solved. Remember, you need to see yourself. You need to look and see yourself. Where the Board of Nursing put you. And the question, the Board of Nursing is talking to you. The Board of Nursing is not talking to anybody. The Board of Nursing is talking to you. Let's say, you have a doctor who came and said to you, let's say you work, I believe in the ED, we the nurses, we push propofol, we push all the, socks, we push all of those drugs. But in ICU, the nurses don't push those drugs. If they're intubating a patient, the doctors have to push the drugs. So now, if I see myself in ICU, the doctor's asking me to push the propofol, I will say no. So because my scope of practice don't give me that luxury. That luxury is for the ED, not for the ICU. So now, let's say, I'm in the ED and the doctor ordered a large dose of insulin. Let's say the doctor said, I want you to give 20 units of regular insulin to that patient. And because the patient blood sugar is like above 500, 20 units. The first thing I need to do, I need to look to see I told them. Oh, okay. That might seem. That might seem. Ça passe là. Tamam. Okay. So, let's say, let's say, the doctor said 20 units of insulin. I don't have no question. You don't have no question for the doctor. As an RN, your job is to go inside the room and assess the patients. You go inside the room, the patient only 100 pounds. So you go back, you say, doctor, the patient is 100 pounds. Are you sure you want to give 20 units? Yes. Doctor, I do not feel comfortable to give that much of insulin. So now if the doctor insists, I grab my phone, I call my charge nurse agree with the doctor, I still feeling comfortable, I call the supervisor. If it's on the day shift, my charge nurse is there. After my charge nurse is the assistant director of my ED. If I can't find her, I will if I didn't find a manager, I'll go to the assistant director. If all agree that the dosage is fine, I will ask one of them to give it because I'm uncomfortable. You have the right to protect your license. You have the right to refuse, but at the end, you gotta refuse in a professional manner. You have to refuse in a professional manner. I feel uncomfortable. I don't think I'm able to do that. And if you insist, the doctor will not, you could go back to the doctor and say, Doc, this is the insulin you asked for. I'm uncomfortable to give it. Can you please give it and document? You will see how fast the doctor will decrease the dose or will cancel the order because they don't want to give it either. Know your right, know your facts, know how to study. You go to www.thekeytoinclex.com. You see all the courses, time and dates. The book, my book is on Amazon. The Key to Inclex is in Barnes and Nobles, the hard copy and online. Engram is in Alibrace, is in Book of Millions, one of the largest bookstore in the United States, in the New York State, sorry. It's there. So, guys, don't pas oublier nous carré dans 631 708 21. Avant nous vinn là, pour nous faire groupi, marché appelé bay moun cadeau, marché tapoter, bay moun passer sous nous, make sure nous sécuriser carrière nous sécuriser tête nous sécuriser commerce nous. Pas oublier que nous avons besoin de faire leçon, nous avons on ganti pas dans 347 401 75, leçon de $57. Ma pour dire nous ça encore. Dans la vie, c'est où qui protège tête ou. Dans la vie, c'est où même qui baille tête ou renfort pour demain. Dans la vie, loge problème, moun pa kan pa avoir. You need to stand for your own problem. You need to make sure that you you could take care of yourself. Because if you look at what's going on Facebook, you look at Pierre Jojo now is in a la land, nobody give a shit. Take care of yourself before ou take care on l'autre monde. Goumen pour tête ou before ou goumen pour l'autre monde. Okay? So, make sure que ou goumen pour tête ou. Make sure que ou comprenne, ou pas ka vini ici ou gen 15 ans, 7 ans, ou pas jamais ka passer un board of nursing exam, ou gon licence, ou gon diplôme qui ka met manger sous tabou, ou ap occuper moun, ou ap occuper vagabond kap dou baka étudier fin grand moun, a fait gado. Vinn joindre Marie Senat 631 708 21 21 pour Marie Senat mette nous travail pour nous capable de cob nan men nous pour nous régler cause nous. Ou même qui sont Haïti qui ont nurse ou ta remen become nurse ou t'es nurse en Haïti ou ta remen fait process pour prendre examen pour gagner licence nursing aux États-Unis contactez moi 631 708 21 21 ou bien passer sur website. Sur website dans l'agence secure c'est pas mon paye ou paye exactement et facility entity par contre comme relève then your book comes to you, everything comes straight to you. Et pas oublier que dans live TikTok que ap gen pour fait, pas oublier que c'est dans live ça yo. M'a gen live review, live professionnel, yo pour me dire qui jour pour commencer. So n'a commencé. Kounya là c'est live pas m'a fait pour me régler. Yeah, we have the book. We have the book for RN. We have it for European as well. And we also have the book for CNAs. We have the T's. Look, there's volume 1, volume 2. So, si vous besoin acheter question and answer, I go to the book, allez là et pour cliquer. So, yes, it's for LPN and RN. Let me tell you, anybody who told you need a different book for RN, tell them Alexis n'a dit menti. Parce que the reason you don't need a different, ou pas besoin l'autre book pour RN. All you need to know is your scope of the scope of an LPN. When you know the scope of an LPN, you could study in any book. Yeah, it is for PN as well, my dear. Ou même qui t'a aimé préparer examen ou t'a aimé entrer dans l'école nursing, ou capable passer sur website là, ou capable acheter des courses en tout pour préparer 6 ans pour préparer pour entrer dans l'école nursing. Ou même qui t'a aimé non seulement ou t'as aimé jouer dans bon l'école, LPN dans bon l'école, non l'école a fini dans 6 mois ou après les Maricina. 631 708 21 21 nous connaît Maricina pas voyer nous aller dans l'école Rabocha. OK, parce que bon l'école là qui a bien frappé et son l'école qui reconnue qui dans New York, pas occuper aucun l'école dans Florida voler ça yo, c'est prend comme monde faire classe un grand jour par semaine et puis les fini moun yo pas apprendre rien. Okay? So, yeah. Nous gagnons sous passer sur website là, côté Berlin. Berlin mettez website là, moi. Vous passez dans website là de kitouenclex.com. Ou avez tout service net. Et tout service net. Et pour moun qui t'a aimé sponsor de kitouenclex.com pour mettre logo nous dans page parce que page ça pral virer et website là pral virer ou capable relem tout dans 631 708 21 21 ou capable sponsor et pour me sponsor dans website là et $1000. OK, nous capable prendre 3 sponsors dans page là $1000 ou envoyer $1000 là et puis n'a sponsor dans page dans web page là non website là $1000. Okay, merci Rosie. Well, yeah, go. You could get it on Amazon. You could get it on Barnes and Nobles. You could get it on anywhere. And then, let me call the guy to see if he's put a logo. You could take review as you go. So, moi, pral gen as you go review, c'est un monde qui pas grand pile kob qui vle prend review once a week. Li ka join class ou gen passage pour once a week là. Ou vini one day a week. Et one day, 1 week, ou paye $100 pour journée, hein. Et chaque semaine, vous payez $100 par semaine. Ben c'est one day, vous êtes capable de participer seulement et vous prenez toute full class pour 2 heures, 3 heures dans le bail là. Game on that's all they need. One day, but class, the review class is 1,000 for LPN. It's 3 weeks. And then it's Wednesday, Thursday, and Friday, I believe. And then there's one is, 3 weeks too. And nice 3 weeks too is 1,300. You need the review. You could go on the webpage. You could call me first, 631-708-2121. And you could also go on the webpage. And I'm asking, because, you know, the money is very secure with Amazon, with Barnes and Nobles. I'm looking at my Amazon. I see people are buying. Et mon kap buy yo, c'est bon, baka di mon na Facebook. Parce que moi, ouais, mon a pas acheté. Me dit tout le monde merci qui a acheté livre là déjà. Il a continué à acheter livre là. Et puis, m'attend nous tout dans région pour nous tout faire, nous, encore pour nous réussir dans la vie. Parce que y a 2 jeunes qui faire sous terre, nous voulons réussir avant de mourir. So, c'est 631-708-2121. Ou même qui ont question de nursing, ou ont question par contre qui côté pour orienter ou pour nursing, ou capable les moins also, et pour pas carrer les mamies, mes amis, nous carrer les moins de 9h, nous capable fil form dans tout dans website, là. Moi, de Berlin pour mettre ton website en bas, moi, là, pas j'en mettre le bas, well. OK? Ouais, moi, so, nous capable passer. C'était un réel plaisir si mon m'appelle encore plus tard. M'appelle plus tard pour nous faire parler plus tard. M'appelle ni dans TikTok ni dans Facebook. Et puis pour nous parler de review. Merci. Rosie, nous capable de dans 631 708 21 21 ou bien passer dans de qui toutlemonde.com. C'est un réel plaisir, pas oublier que nous tous nous dans pays à pour raison bien déterminée. Moi même pas temps pour zin à moun. Moi pas n'importe zin pour encore moun qui veut venir la battre corps, faire tintin, ça c'est bagay qui gado. Tout monde c'est chaque coucou éclairé pour jour. Tout le monde mettez corps dehors, mettez gun dans moun dehors pour régler causo, mettez gun dans moun dehors pour avancer parce que tout le monde a avancé, tout le monde canal book you look good. So, ou même tout dégage pour régler fort. Pas gen moun qui doit personne promotion. Moun n'a fait promotion pour Sylvie. Si moun n'a pas vle encore de bébé payer ou de compte payer, ramassez paquet au revoir, messieurs, au revoir, madame, c'est qu'on salda supposé. Tant pis pour moi, tant pis souple pour moi, qui t'aime faire review, moi, qui t'aime bail peuple la connaissance, qui t'aime retirer en série de moun dans misère, qui t'aime retirer en série de moun dans fait noir. Merci, c'est ton réel plaisir. Numéro de téléphone, moi, c'est 631 708 21 21. OK, Miss Walter chérie. Merci, OK. Et puis, website là, c'est de qui to enclick. C'est un réel plaisir, moi, mais nous pas oublier, fête Queen, c'est de merci Dieu veut qui c'est bleu de Ferdinand danger. 4 août, nous tout massivement préparé pour nous tendre qui ça Queen pour le dire nous, parce que lui dit, la vinn causer, la vinn parler avec nous pour faire, lui, napton Queen, de merci Dieu. C'est un réel plaisir, moi, mais nous, en pile le peuple.